Welcome, I'm Dunbar Ivy. I'm Chief of Pediatric Cardiology at the University of Colorado and Children's Hospital, Colorado. I'm a prior board member of the Pediatric Congenital Heart Association, and I'm currently on the Scientific Advisory Board. I'm here today with David Kasnick, who's an initial board member of PCHA. So David, why don't you tell us about your journey a little bit and why the PCHA thought it was important to develop the portal?
Yeah, I co-founded the Pediatric Congenital Heart Association a little over 6 years ago with another parent, really in the hopes that we could add a level of advocacy to congenital heart disease patients and families. And this really wasn't something I ever planned to do, but as a parent of a child with congenital heart disease, it's something that I felt like I needed to advocate on behalf of her and then others living with congenital heart disease, being that it's the most common birth defect out there, and really nobody knows that fact. So with this portal came 6 years of summits and meetings of trying to see if we can get transparency in public reporting of data from hospital outcomes. And this has kind of been the culmination of those 6 years, is create this portal and having this public-facing interface tool for patients and families to use.
So why don't you tell us a little bit more about the portal? Exactly what is it?
The portal is a public consumer-facing interface tool that uses outcomes data from centers like yourself. Children's Colorado has been a great partner in the fact that you're willing to give us your data that we can put on this portal so that families and patients can use it to make informed decision making about their child's surgeries or different interventions that they're having at that center. And there's really nothing out there like this. This is why we have to create it, because the patients and family need this information to make informed decisions about their health care.
Do you think it's good for both the patients and the heart programs?
I do, just because it's, like I said, there's really nothing out there. So if you're making a decision about something random in life, about even your kids' eating habits, you'll probably Google or you'll look at nutritional information on a box. Really, there's nothing out there for patients and families to use to make these decisions. So we're standing up and saying we're demanding this information from centers. And there's nothing wrong with saying, here's our outcomes. People aren't scared about necessarily bad outcomes. They're scared about those outcomes being hidden and not being transparent to the patients and families.
So David, give me an example of how you think the portal could help a family.
Yeah, if a family is facing surgery or a patient's family surgery, they can go into the portal, look at what's most important to them. It could be anything from distance to the center, the certain programs that exist at that center. Do they have a single ventricle program? Do they have a transplant program? What's the surgical volume? What are their outcomes of that surgical volume? And really decide what's most important to them to see if that's the most appropriate place to get their care. Most patients and families really just want to be at a center that's safe. And if they can be at a safe center, choose that center because of their outcomes, not because of something that is a ranking that doesn't really matter to patients and families. So pick one center, pick another center, talk to both, and feel more comfortable about those things that are most important to you. It may come down to, I don't want to drive as far as I have to go to the other center. I don't want to get on an airplane. I can't take off time to go to that center. But with this portal, you'll get that information to say, I'm at a safe center and they have all the programs I need and they're being transparent about their outcomes. So they'll feel that their center is the appropriate place to get care.
So David, if you were a patient or family and you didn't see your center on the portal, what would you recommend?
If I was asking a center why their information wasn't on the portal, I would say, do you believe in transparency and what does that mean to you as a center? And do you publicly report your data? And if they say yes, you could ask them, there's a publicly reported database called the Society of Thoracic Surgeons. Do they report to the Society of Thoracic Surgeons? If they say yes, then say, are you willing to share your information on this portal so it can be added to the list of other centers that are saying, we publicly report and here's our outcomes?
Okay, so I think, this is an introduction to the portal. There's another video that's going to be on the PCHA website about exactly how to use the portal. So David, anything else to add before we wrap up and move on to that next part?
If we don't stand up and say we need and demand this data, it'll never be there for the future.
Thanks very much, everyone. If you have any other questions, there is information on the Children's Hospital Colorado website, and certainly you can also look at the Pediatric Congenital Heart Association website.